Two, one.
Hello, California. It is Thursday. It is November. I don't know how that happened already. And we are joining you live today, highlighting another amazing organization that we are so excited for you to hear more about. November, you might not know, is Native American Heritage Month. And today we are being joined by the Sacramento Native American Health Center. Specifically, Britta is here with us today. Hi, Britta, how are you?
Thank you for having me.
Thank you so much for being here. Again, we are just so excited to talk about all the good work that your organization does. But I thought what might be nice is to talk about, since here we are already in November, right? This weird, strange 2020 where it seems like the longest day, but also I can't believe that we're already here in November. Given that November is Native American Heritage Month, can you talk about why it's important that we recognize Native American heritage, particularly this month, but obviously throughout the year, it's important to recognize. But especially since November is Native American Heritage Month, why is it so important that we give the due credit and focus to Native American heritage?
Well, I think at least there are a couple different perspectives, obviously. We have a lot of recognitions that are assigned to different months. I work at a Native American organization. I'm a Native person, and so every day is Native American Heritage Month. However, for other people, they associate Thanksgiving with the Native American community. And while we are grateful for that, we feel we appreciate the increased visibility around the Native American community during the month of November. It's really important that you learn the tribes who are currently around you. We are still here. We are not in traditional regalia. I think often people don't see us. We lack that visibility if we're not in feathers or leather. And so making sure that you know who the original people are, where you live, work, and love. It's super important. Those folks are still there, and the contributions that we have made to the community. We're the original stewards of the land, and being in California, which is such a beautiful place, we've had a lot of contributions in this state, and it's fantastic to be a part of the community.
I love what you said about visibility and how important that is. When I was doing some research ahead of this interview today, I realized that there are 109 federally recognized tribes in California, making the state the home to the largest Native American population in the country. So that's really, I think, an important statistic for folks that are joining us as part of the Our Promise campaign to be mindful of, because it's a statewide campaign. And wow, gosh, with 109 different tribes, that's such diversity. So can you tell us a little bit about the great work that the Sacramento Native American Health Center does and what you guys do on behalf of the community?
Sure. So there are 109 federally recognized tribes, but there's also a number of state recognized tribes who are pending federal recognition. And then we are an urban Indian health organization. So we were established to serve Native people who live in urban areas that are not currently being served by the tribes. So there were several federal policies in place that moved Native people from reservations to urban areas under the guise of additional employment and educational opportunities. And folks ended up establishing families and extended families in urban areas. So we are here specifically to serve Native people who live in and around Sacramento. But in addition to that, we're a federally qualified health center. So a federally qualified health center means that we get additional federal funding to serve the uninsured, underinsured, Medi-Cal populations, and then obviously the Native community is our target. So we provide primary care. We have a comprehensive dental program. We have a behavioral health department, inclusive of psychiatry, multiple support groups, prevention programs, substance abuse counseling. We have
Wow.
a community-based outreach program, and then we have several different specialties, specialty providers and specialty programs in addition to optometry. So really trying to create a one-stop shop for people to remove barriers to healthcare.
That's incredible. That is a lot of services, vital services that you're providing to the community, which is so important. You know, we talk a lot about 2020, and ahead of this call, we were talking about sort of this new normal. You know, obviously the need doesn't go away just because of the pandemic. And then sometimes the pandemic has made the need even greater. How are some of the ways that your organization has had to pivot in terms of the services that it's offering and how they are being offered because of the ongoing coronavirus pandemic?
Well, I think we've learned a lot of lessons through the onset of the coronavirus. And I think if it's taught us nothing, it's definitely taught us that communities of color are disproportionately affected by the infection and then by more serious effects of the illness, and then also the statistics in which people are actually dying, which is terrible to say and to think about. But we've had to make a lot of changes. We have had to really pivot and create the opportunity for patients to be seen over the phone, to access their providers via telehealth, to participate in community mandated groups like parenting and anger management and substance abuse support, supportive services over Zoom. And one of the things that we were able to kind of determine is that many of our patients have cell phones and not so much regular connectivity. So we have had to provide technical support. Actually, one of the partnerships that we have through the United Way is to provide hotspots and to provide laptops so that patients can see their physicians if that's how they choose to do their visit. And that face-to-face contact is so important for patients to really be able to inform their providers of how they're doing, to actually walk to their medicine cabinet and pull out the medications that they're taking and
Right.
show those medications to their provider and really still be able to connect. A lot of healthcare is built upon having a relationship with patients. And so making sure that there's no disconnect in that relationship is so important.
Wow. And exactly. I mean, just the continuation of care and making that a priority means in years like 2020, you might have to become an IT issue expert, right? Things that you weren't necessarily planning for. And I think that when you speak about all the different types of services that you do offer, it's so important that we get the information out so that the communities in which you do serve know that they're there. How are some of the ways that people can find out more information about the great work that the Sacramento Native American Health Center is doing?
So we have a website. It's www.SNAHC. So it's our acronym, Sacramento Native American Health Center.org. We have a monthly newsletter. We have a Facebook page. We have an Instagram. We have a fantastic development department who really is focused on internal and external communications, letting the community know how they can join our ongoing support groups, what the schedule looks like for the week. Maybe folks find themselves without health insurance for the first time. And so we walk them through that process of how to apply for Medi-Cal, how to get in for services, kind of the things that you should be thinking about as far as your gender, your age, and what are the preventative screenings that you should also be thinking about, especially while we're sitting at home. How do we take care of ourselves and make sure that while this is a time of tremendous stress, that we're still finding ways to keep ourselves healthy, mentally, physically, spiritually. What does that look like for each individual? So connecting folks in whatever way that we can.
It's so important to be mindful of exactly that. You know, how are we prioritizing our health in this new normal? Britta, we're going to link to all of those websites and social media handles that you just referenced in our Facebook post once we archive this conversation. But I know that in Midtown, you're kind of located in the heart of Midtown here in Sacramento. Is that right?
Yes. So we're at 21st and J Street. We have a very large campus. It's almost the entirety of a city block. Wow. And we are very shortly expanding to South Sacramento off of Warren Road in Franklin.
Well, that's fabulous. Congratulations.
Thank you.
If there was, before we sign off, sort of one takeaway that you would like to leave people with, again, these are really philanthropic state employees who have really prioritized giving back, particularly this year, right, as the need is so great. Was there anything that you'd like, we're wrapping up the campaign in the next couple of weeks. So we're right here at the home stretch, and we just want to give people sort of that motivation to finish strong. Is there anything you'd like to say to these philanthropic state employees?
I would just say that the contributions from the Native community are many, and the visibility of the Native community is often overlooked. And so to have a Native American Health Center located in the heart of Midtown, so close to the Capitol, where all of the restaurants, and we've created this space for ourselves so that we're part of the Sacramento community at large. We take care of Sacramento, and everyone is invited, everyone is welcome to be seen here. And that's the way that we have this collective responsibility, that taking care of others is what we do, that no matter where we end up, we want to make sure we leave things better than we found them. And I think we're doing that.
Well, I think you are too. I think that the work that you all do day in and day out is really a testament to how much you care about not only the Sacramento community, but California in general. Britta, thank you so much for being here and helping storytell again about all that great work. We are so inspired by your efforts. So thank you. It really means a lot to have you here today.
Thank you for having me. I appreciate it.
It's our pleasure. And again, we will link to all of those websites and social media handles right here on the Facebook page. Thank you so much, Britta. We really appreciate your time today.
All right. Thank you.
Have a good one.